Rachel, it's not that often that I go into a podcast episode with you expecting one thing and hearing something so very different. So, of course, I thought we were going to be speaking with Soum today from Mystery Vibe about another vibrator company, and I could not be more wrong. This is really a health and wellness company that focuses on real medical issues that people are dealing with who want to use a device to perhaps really help with their pain or their condition as it is. So, super interesting to hear about the use of vibration and different megahertz in vibration in terms of health benefit.
It really was it's a cool approach. And, when we talk to him about how is he getting the word out, how is he getting physicians, we know how hard it is to get a piece of the physician's mind who's working on so many different areas with his or her patients. And he said, very simple solution. We literally go to every industry conference where the people who could recommend this product are. And he says, they go to something like 20 a year. I mean, I feel as a business person, you could be at one of these every minute and you have to pick and choose. Their approach has just been to blanket them all.
Yeah, I think that's pretty wonderful. It was also very refreshing to hear that there is a true male side for vibration and devices to help with health benefit and pleasure, and not only in the women's health space. So let's take a listen. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V-Health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We're so excited today to have our guest, Soum Rakshit, who's the founder and CEO of MV.Health, which was formerly Mystery Vibe. We'll mention that because we'll get back to that. Welcome. We're so happy to have you.
Thank you so much for having me. It's a great way to spend Friday afternoon.
Thank you so much. Well, so tell us a little bit about you and Mystery Vibe and how you got here. You have an interesting background.
Very simple background, I think, as an engineer. So I spent all my teenage years building computers and then naturally ended up studying electronics. And then I really liked the medical applications of electronics. So I did a PhD in biomedical engineering, focusing on ophthalmology. So our application was iris recognition, so looking at eyes and biometrics, so matching that, mainly in security and defense. This is back in 2004, so 21 years ago when biometrics was still very early days. And our rollout was iris on the move, so walking through a gate in an airport and then being able to pass through at walking speed, which was quite significant back in the day when processor powers were tiny. So that's what we built. So we did that as part of our PhD and postdoc. And then at the end of our research, the company got acquired by a US defense contractor in California. And it's still used today. So if you go to Dubai, you'll see a little camera at immigration control, and it will say cross match, and that's one of the systems where we implemented our iris recognition. So that was really exciting. I really enjoyed working with defense, even though we came from the biomedical side. So then after that, we as in the whole team, we were thinking what next, where we can apply our engineering in a different field of medicine. And the topics that kept coming up, and this took a few years of talking to both just friends and family, but also healthcare professionals, is urology and gynecology, like major life events. So childbirth, pain after childbirth or menopause, dryness after menopause, recovering after cancer, recovering after treatment, aging, just normal aging related stuff like erection issues, ejaculation issues, prostate health, cancer. So and because we're talking about 15 years ago, we only found these by talking to people intimately, like asking our own friends and family, what are the big problems? And then you'll get to learn that 1 in 3 women who are menstruating have severe period pain, which wasn't really talked about back then. And the fact that it's 1 in 3 is so significant that it's not talked about. So, so it became obvious that this is an area where significant patient populations exist, but not enough solutions, not enough discussion, not enough education. So then, we through a program here in London with NHS, the National Health Service, there is a program called Clinical Entrepreneurship Program. So we met the head of the NHS CEP, and he is a urologist himself, and he connected us to his professor, who's the chair of surgery and chair of urology at King's College, who has been researching on vibration for over 3 decades. And he was very excited to meet us because he's a surgeon and he has a lot of ideas on how engineering can be useful in medicine, but it's not something they could build internally. So he became our chief medical officer, um, and obviously connected us with lots of urologists, gynecologists, pelvic floor therapists, both in US and UK. And where we started was um, the big topics like pain after childbirth, really like probably 90% of moms have some pain, erectile dysfunction, really major topics where we could be useful. So our very first product, Crescendo, was designed to mimic um, 2 fingers. Yeah, so very much recreating standard of care using engineering. So that's the long story behind how we started.
Got it. I have a million questions, but I want to understand from a scientific standpoint, when you speak about vibration, are you really speaking about enhancement of blood flow through vibration, or is
Exactly.
there some other benefit to vibration that I'm unaware of?
And so the clinical evidence that exists, and this is long before we started, this goes back 5 decades, um, is around 50 to 100 hertz, typically 100 hertz frequency vibration, which has been applied in various sexual dysfunctions and has done well. And there's continuously new research coming out, like Dr. Alexandra Dubinskaya at
Yeah,
Cedars-Sinai. She's published a lot. So, and this is completely independent, and this research exists, which makes our work easy in the sense that we are not creating fundamental research. We're doing application.
yeah,
And it's very much blood flow. So whether it's blood flow for arousal, blood flow for lubrication, blood flow for erection, blood flow for pain relief. So and it is not that different from using a Theragun on your back. It's just
right.
a different vibration frequency and a higher power for back pain. So for example, one of our technology is used in a US back pain company called Pain Care Labs, who use that for a belt that adapts to the back's shape. So the applications are actually very generic when it comes to vibration, and it's very well established.
So let's fast forward to some of the devices that are used in my field of gynecology, and I'm mesmerized by the fact that you really reach both men and women in this particular device area. And I think that's very interesting because, of course, I only take care of women, so it's kind of cool to hear about both. Um, and what I do notice, the devices are incredibly cool. I love that they're bendable and malleable and super interesting in terms of shape. A lot of my patients might feel a little threatened by larger devices. Can you speak to that, and how did that come into play in your design process?
That is such a good and such an important point. So even on pelvic floor therapy, where we have a device designed to mimic two fingers because that's what PTs helped us design, saying they use two fingers to reach and press the pain points. Even there, our other device, which is a single finger device, which was originally designed for prostate pain management, is now used for various pelvic floor therapy patients who don't want to insert a two-finger device. And so you're absolutely right. The size is it's such a big factor, and that's also why our research studies have been so effective, is because the products are really malleable, so the patient can use it on themselves and adapt it little by little to see exactly where their pain or arousal needs are and get to that point and deliver the vibration exactly where they need, which is what they would get in therapy, for example, by a back and forth discussion with the therapist. Um, but this is something they can do at home on their own time, and be even more precise because they know exactly what they want. So the shape and size and adaptability was the foundations, and truly that's the only innovation from our side. It's not vibration research. We obviously customize the motors to deliver the right frequency, but
Yeah,
so that is already established well as to what will work. Our goal is to make it very user friendly, that someone say in their 70s, a lot of our users, especially on vaginal dryness or prostate pain, are in their 60s and 70s, and they don't want complicated tech. They don't want Bluetooth and apps and mess. They just want something very simple. They can turn it on, they can adapt it, and they can use it, and it's effective. So like simple things like big buttons, which are easy to use. So for people whose fingers might shake, or their
yeah,
visibility might, the vision might not be perfect. So those are the things we focus on a lot. Um, i- Beyond efficacy. Efficacy is obviously very important, but even after we've achieved efficacy, we constantly look for user feedback to make the devices more and more adaptable and user friendly, which
yeah, yeah,
also means coming up with smaller devices. Say for
yeah,
example, Tenuta 2, when it first came out, and it is really effective because it's very big and powerful, but a lot of people said they don't want to use it because it's too big. For
yeah,
some people, it
yeah.
was super effective because it does perineum and penis. So Tenuta Mini came out to be like one-fourth the size, so 25% of
So are
Tenuta
you
2.
focusing more on the medicinal or medical aspects of the vibration use, or the pleasure aspect, or both? And that's fair too. But from a pleasure standpoint, some of these did look a little bit larger than many of the other devices out there. But from a medicinal standpoint, I don't think anybody wants to use anything too tiny because they want a good effect. So,
Yes, so I mean, all the work is done with, it's like iterative process where we would build something, which is why we do initial manufacturing internally in our labs. So we build it, and then we'll do clinical trials, and then typically we would
okay.
go back and rebuild it. So all the work is done in order to get sufficient efficacy before we launch it. And in 100% of the cases, version 1 is good, but not good enough because we never
Sure.
know what we need to improve till it's out, with tens of thousands of users. So then, we constantly iterate version 2, version 3, etc. So the primary goal is, generally we pick a topic. So let's say prostatitis. So we design Molto in order to address prostatitis. So at a high level, that's the first thing we would test. And then as long as it crosses 80% efficacy, then we are ready to launch it. Um, but our goal is through rapid iteration, and rapid is still years, um, get to 95% efficacy. So now we have
So
200,000 patients. Yeah.
So in your messaging, obviously, there are people who don't understand or are not aware of the science and might just say, this is another sex toy company, which is not meant to be
Yeah.
disparaging at all, because there's huge use and benefit to those products. How do you communicate to consumers, this isn't just going to feel good, but it's good, potentially good for you?
I think the better way for us is not just us saying it, but healthcare professionals saying it. Urologists saying it, OBGYN saying it, pelvic floor therapists saying it.
Talk a little
That
bit about how you
Yes,
build those relationships, because,
yeah.
as Alyssa knows better than anybody, there are all kinds of people asking you to talk about their products and recommend their products. What have you done? How
Yeah.
important is the healthcare practitioner in your referral process, in your purchase process, and how did you build that trust?
Um, it's a very simple answer, very difficult execution. Is being present in every single healthcare conference and exhibition in our space. So, so that's the short answer. But it's literally physically being like, we're in a couple of weeks, we're at AUA, we have a stand. 2 weeks after that, that's in Vegas, and 2 weeks after that, we're in Minneapolis, standing again in a booth. So we do at least we do like 20 exhibitions a year, whether it's ISWITCH, ACOG, AUA, NAMS. Like there's too
Wow.
many, right? And I feel there isn't really an alternative. There's no online version of any of this. You need to physically, and we've been doing this for 5 years. So we and we also love the extra feedback we get from meeting people who are walking past who has never come across our devices, and they might pick one and say, oh, have you thought of using this in a different application? Like, and I give you a really good example. One of the doctors picked up the Molto device at a conference a couple of years ago, and so this would be really useful for my diabetes patients to help them with ejaculation. And no one had ever done a published study in that area, because there isn't any device to stimulate the prostate till Molto came out. So once Molto was ready, we sent him box of Moltos to study, and a year later, a paper was published recently, a few months ago, in the Journal of Sexual Medicine. It was the first of its kind where using a device to stimulate the prostate to help men with an ejaculation ejaculate. It was very
Yeah.
successful, and the urologist knew immediately that it will work in theory, and he was confident. And he said, just send me the devices and I'll do a study. So that's the kind of stuff that is super useful. And then, of course, meeting the clinicians we work with, uh, building the relationship, giving them devices to give to their patients, um, getting feedback on what should we be building next. Like one of the feedback we got last year was building a compression sock for post-penile surgery, because right now bandages, it's quite cumbrous because the patient at home after surgery has to put the bandage on, take it off, put it on.
Yeah.
So we then figured out a way to use magnets inside silicon to create a compression, which is obviously waterproof, reusable, and a single hand operation. So they can just pull it off and make it as tight. So, and that was completely just interactions,
Yeah.
standing in our little booth with our devices and leaflets, and meeting, over 5 years, thousands of clinicians, um, and and then, as the clinicians get good feedback from their patients, often they would talk about it in social media, and then they talk to their friends about it, and then the word of mouth spreads. And also, I think being present and supporting the conferences is important for credibility, because if we never turn up to anywhere and just sit in our labs, it doesn't look like we care about the wider discussion, and just care about building what we think is best.
Here's today's hot flash. Did you know that vibration can actually have medicinal benefit? It can help to increase oxygen flow, blood flow, and even help to benefit pain. Very interesting. Of course, my experience is only in women's health, but I will say that I have noted dermatologists using very small vibrating devices to make injections of whatever is being injected less painful. So I never really thought about vibration for pain control, but rather just for blood flow. Can you just speak to the mechanism of how the pain control is really working?
So the theory is still the same in terms of fresh oxygenated blood flow in the pain areas. And then the other piece is the pressure from the device on the knots and the scar tissues. Yeah. So it's two separate pieces. One is using the device to push down on the
Mhm.
areas which would be typically done with fingers, and then the vibration on top. So in the instructions that the PTs wrote for Crescendo, they suggested do not use vibration to start with. Just insert the device and bend it to find your pain points, um, without doing anything else, and then press them. And then when you feel a bit more comfortable, turn the vibration on very slowly, and then build it up as much as you need. So it's both the pressure from the device being able to be very specific to that point, and then vibration on top. So in
Excellent.
theory, all it's doing is recreating the therapy. Um,
Sure.
yeah.
So many of the platforms that I have seen with pelvic floor physical therapy specifically rely a lot on biofeedback through an app or through some sort of biofeedback device where you can actually measure success. How can people measure their success with some of your devices without having that type of feedback? And believe me, I understand, particularly in the, somewhat older population, they don't want to have more tech. So I think this is a benefit. But how do we measure success?
Uh, those 2 points are so important. I'll talk about the second one quickly. Um, so we have an app, and the app is really to set very specific vibration patterns. We mostly use it for research, but it's free. It's available to the users. Um, what we found is, especially with our older population, if they think they need an app to use the device, that's a deterrent, and they won't
Yeah,
buy the device. They're like, oh,
exactly.
do I have to download an app? I have to connect to my Bluetooth. I can't be bothered,
Mm.
right? So we don't even talk about the app. They're like, yeah, it's there. Yes, the younger population find it interesting, but in our entire 200,000 patient database, less than 30% ever use the app. Um, and there is a second really important point in sexual health about worries of what happens to the data. So
Mm.
since the beginning, since 11 years ago, we have never had any logins in our app. There's no data capture. There is no email, no IP address, nothing. It's literally a hardware controller because that's the reason we built it. So you can update the
Mm.
firmware, like you would on a Sonos speaker. You don't use it once in a
Sure.
while. Um, we use it because we can set patterns for medical studies, and or the we can teach the clinicians to do it, so it's very useful. But from a app perspective, we find in most cases people are worried about using an app in sexual health than devices, than yes. So to measure technically, we use FSFI. So all our
Okay.
studies are with FSFI. So that's how we do all of our studies measurement. But in terms of users who wouldn't really do measurements, because a lot of it is in very obvious areas like pain or erection, or lubrication, they will know pretty much within a month. So what we do is we have a 30-day no questions asked refund policy because we know that it's not going to work for everyone. And the challenge from a user's perspective, especially from at-home care, where they're buying something without having talked to anyone in person, is they're not sure if it will work. So um, that's how we measure our efficacy is, and this is literally, you just send an email saying, it didn't work. That's it.
Sure.
So that's how we measure efficacies, because 1 month is generally enough for you to know if it's going to work. And within a month, if it doesn't work, we'll refund you. And also, we'll
Yeah.
recommend you other devices you can
So,
have.
so in
And
terms of
95% do not ask for a refund. So 5% ask for a
which
refund.
is great for a device business. Is the business, so the doctor might recommend it, is in terms of the purchase, is it all direct to consumer, or are people buying it through their physicians? I know it's often a big deal for healthcare practitioners to carry the inventory. What is the purchase approach and
Um,
set of
so
options
it,
that users
it
have?
it's quite a mix now, because originally, like say a year ago, we were 100% D2C, and
Mm-hmm.
we set it up that way in order to get direct patient feedback, because that's the big issue we have when we go distribution, is it's us to distributor, distributor to clinician, clinician to patient, and patient never contacts us. If they have
Right.
a problem, they talk to their clinician, which is fine, but that doesn't help us in making our products better. So we wanted to get to that number of 200,000 users, so it's statistically significant, and then do distribution. So now it's different, because now yes, we do have D2C and anyone can buy it and they can use their FSHSA cards on our site. But then we also work with Medline, who then supply to clinicians. We also sell to VA,
Yeah,
who
talk a
then
little bit
sell.
about that. That was interesting to learn about that. I wouldn't think, um, that the idea of selling sex toys to military hospitals or VA is something that is common. So talk about how you built that relationship and what the messaging around that has been.
That is so true, and neither did we. And it happened completely by accident. So we, as you know, like with any other things we do, we are in every exhibition meeting doctors, and this happened over many years. So as more and more doctors started recommending our products, some of them were also working in VA. And what happened over the years is they realized the single biggest item in VA is erectile dysfunction drugs. Yeah, which is obviously
Wow.
very common in PTSD. Yeah, so given obviously drugs are expensive in the long run and generally have some side effects, they were very keen to have a device alternative um, to offer their patients. So it happened kind of in the reverse way, where we didn't approach VA. we we're working with a lot of doctors generally who happen to also work in VA, and then they asked the procurement to put us on the list, um, which then happened again. I think it took another year, or it was a very slow process, but exactly like what you were saying is we never went in with that plan that we are going to approach VA, we're going to be on the procurement. We didn't even know that this is relevant to them.
That existed. And how is that going in terms of being a source of revenue generation? It's relatively new.
It's very new. So we got added in January, so only a couple of months ago. And interestingly, even though the original discussion started with ED, once they look at our portfolio, they said we want to add the others because pelvic pain is really big in
Yeah.
female veterans. Dryness is an issue. So prostate obviously is an issue with aging. So they said, actually all of these are useful. So all 6 devices are added. But again, that wasn't like no, I'd love to take credit that we planned all this, that it was really not.
It
So
makes perfect sense, though. It's cost effective,
it's very,
it's
yeah,
non-invasive, it's not a drug, and I think that's the name of the game when it comes to these large organizations for sure.
yeah, yeah. So exactly. And so yes, it's very early days, but then the big thing that will happen is once we set up US manufacturing, then we can be on the procurement contract. So currently we are there's a technical term, I think it's like private market. So when a VA doctor recommends our device to a patient, VA purchases it directly from us for the patient. So it's a very one-to-one thing. It's not very scalable. Yeah. Uh, but let's say by the end of this year, once we are made in USA, which we're currently setting up, then
Yeah.
we can be on Medline's VA or general government procurement contract because we already work with Medline anyway.
So
So
you can
that
really
would
use them as a distributor.
exactly. So then
Okay.
it becomes very straightforward. Yeah.
Okay.
Yeah.
So the revenue generation will happen at that point. It does happen now, but it's a
Much
very
lower.
slow thing. Yes, exactly.
So you've done a lot of things. You've taken a very different approach, clearly not a sex toy approach, even though there could be pleasure associated. Reduction of pain and treating clinical problems has really been your approach. How do you make sure that people understand that sort of all vibrators are not created equally?
Yeah.
No, actually, I would say we recommend. So, like we get emails all the time from people asking. We would recommend they buy vibrators if that is right for them. Like much lower cost. There are so many good quality toys, and if somebody doesn't say they have a specific problem which we can solve, we would not recommend them our devices. So
Got it.
our goal is very much, which is why we have mysteryvibe.com, we have MV.Health. Yes, 90% of our business is MV.Health, but the reason we have mysteryvibe.com is when people don't feel like they want to talk about problems, they don't want to say they have dysfunction, they might just say, I want to have more fun. That's great, right? We don't want people to think that they have a problem and that's why they need solutions. So I wouldn't say it's any different. Um, and also the history of vibrators has been the first probably 50 years was purely medical, then it became uh, mostly pleasure, and now it's
Yeah.
both. Right. So even in the last 100 years of vibrators existence, it's been 50-50. So I think, we want people to think it's fun and pleasurable. We want them to buy toys where it's the right answer. We want them to buy medical devices where they need certain problems solved. But I think both are equally important.
Super interesting. Uh, Maybe in our last 30 seconds here, you can explain why you have two names, Mystery Vibe and MV Health, because I found that pretty interesting in my line of work, of
So
course.
both are MV. So if you think of it as medical vibrations and mystery vibe, yeah, both are MV. And the reason we created mysteryvibe.com as a separate brand is because what we found is a lot of people suffer for years before they go to a doctor, whether it's menopausal dryness, pelvic pain, erectile dysfunction. And this was back when we started, and I don't think it's changed that much. There are so many people suffering in silence who we can educate and reach through more wellness, pleasure,
Yeah.
fun conversation compared to, if you have ED, then this is which is great. And from a clinical perspective, that makes sense. But from a general population perspective, often just talking about it from, do you want to improve your performance, your bedroom, your intimacy, works better. So that's why we maintain, which is a lot of work, but we maintain both in
Yeah.
order to not lose out on educating the consumers who haven't got to the doctors yet.
Wonderful. Let us know where people can find out more information about you and your company, whatever name they choose to look up.
Simple, mv.health, because we couldn't get mv.com.
Understood. Wonderful to speak. Thank you so much for joining us, and we look forward to seeing what comes up in the future for you.
Thank you so much.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.